Welcome to the Vibes Lab, your front row seat to the science behind VIA, the Vibes AI agentic platform making everyday brain health accessible to all. Every episode is designed to reveal insights that will enhance your cognitive health and well-being. Follow us to grab your lab key and experience limitless intelligence.
Welcome back to the Deep Dive. Today we are getting into a field that, on the surface, sounds almost philosophical. But the newest science is showing it's profoundly physiological. We're talking about intentional sound and music as, well, powerful allies for your heart health.
Yeah, it's a fascinating space.
And this deep dive is really tailored for you. Our sources today aren't just playlists or anecdotes.
Right.
We're looking at controlled trials, big meta-analyses, systematic reviews, covering everything from formal music therapy to, things like singing bowls and even just simple vocal practices.
Ancient practices, really.
Exactly. And our mission is, I think, pretty straightforward. We want to get past this idea that sound is just nice background noise.
A pleasant distraction.
Right. And show with hard data that it acts as a direct, tunable input into the very systems that run your heart. Okay, let's unpack this. The evidence suggests sound can influence these key physiological metrics: blood pressure, heart rate variability, even vascular function, pain, and anxiety.
Right.
This is so much more than just feeling relaxed.
That's really the core of it. When we talk about sound affecting the heart, what we're really talking about is the autonomic nervous system, the ANS.
Okay.
This is that non-conscious circuitry. It's the master control panel that's dictating your heart rate, your vascular tone, how you recover from stress.
So it's running in the background all the time.
All the time. And what's fascinating here is sound is sort of nudging this entire system toward better balance.
Nudging it how?
Well, if you think of your ANS like a car, sound isn't the engine, but it is actively, adjusting the accelerator and the brake.
And that's where things like tempo and rhythm come in. Researchers have gotten really good at mapping which neurological switches.
The data's compelling.
It is. We see that slow, steady tempos, music with a sort of supportive emotional tone. It consistently favors parasympathetic activity.
That's your rest and digest system.
Exactly. The body is physically slowing down.
It's the brakes in action. And on the flip side, if you put on some fast, high-tempo music for a workout, that driving rhythm, you're temporarily cranking up sympathetic arousal and your heart rate. You're pushing the gas pedal.
But the clinical takeaway here isn't just, common sense. Controlled trials show that just listening to slower music, even for a short time, can reduce systolic blood pressure and heart rate.
Right.
And that works for both healthy adult and people who already have hypertension. It's a very accessible tool.
And the reviews, they really crystallize this down into 3 reliable mechanisms that are driving this whole improvement.
Yep.
The first one is what we call autonomic modulation, that shift towards the parasympathetic system we were just talking about. We can measure that with increases in heart rate variability or HRV.
Right. So for anyone who hasn't tracked their HRV on a wearable, why is that metric so important?
It's a critical question. High HRV means your system is flexible. It's resilient. Your heart isn't just beating like a metronome. It's making these constant, subtle little adjustments to everything happening around you and inside you.
So more adaptability is better.
A heart that can adapt quickly is a healthier heart. Sound helps train that adaptability. The second mechanism is entrainment.
Entrainment.
This might be the most elegant part of the whole process. Your body literally synchronizes its own internal rhythms.
Like you're breathing.
Exactly. You're breathing your heart rate to the external tempo of the music. If the music is slow and steady, your internal engine just follows along.
So it's not just a mood thing. It's a physical guiding force.
Precisely. And third, we see clear biochemical effects. Listening to this kind of therapeutic sound has been shown to lower stress hormones, especially cortisol.
And we know high cortisol is bad news for the heart.
Very bad. Chronic high cortisol contributes to vascular damage, hypertension. So if sound can lower that biological stress signature, the heart gets an immediate benefit.
That sets the stage perfectly for the clinic then. We're moving beyond passive listening. So how is sound being used as a formal, low-risk adjunct in cardiac care?
And that's the key word, adjunct. This isn't replacing standard care.
Right. It's augmenting it, leveraging sound to cut down on anxiety and pain, to stabilize that autonomic balance during really stressful medical moments.
Absolutely. And the moment music therapy goes from your living room into the clinic, the effects are highly quantifiable. A great example is in cardiac rehabilitation.
Okay.
We looked at a randomized trial, 68 patients, wide age range.
And what happened when they added music therapy to their standard rehab?
They found clinically meaningful reductions in systolic blood pressure from the start of the treatment to the end.
Wow.
More so than the group that just got rehab alone. It's an easy, non-drug way to actually move the needle on a core metric.
It's one thing in long-term rehab, but what about the acute stress of something like, say, cardiac surgery? I mean, that's the definition of stress.
And that's where the meta-analyses are just so powerful. One major review looked at 20 different randomized trials, almost 1,400 patients undergoing cardiac surgery.
And they were given music therapy when?
Before, during,
Before, during, or right after, that whole perioperative period. And the findings, well, they confirm what you'd expect. Less pain, less anxiety. But the crucial part was the cardiovascular metric.
Okay.
Patients in the music group had their heart rate lowered by about 5 to 6 beats per minute compared to the control groups.
Now, 5 or 6 beats per minute might sound small, but for someone recovering from major heart trauma, what does that actually mean clinically?
That drop is huge. When a heart's recovering from surgery, every single extra beat costs energy. It increases oxygen demand on the heart muscle.
I see.
So a reduction of 5 or 6 BPM, that translates directly to less strain on that recovering muscle. It stabilizes the patient, reduces arrhythmia risk. It's a tangible, vital stabilization that costs basically nothing.
So it works, but are we just talking about, background music? Or do we need to get more involved? Well, here's where it gets really interesting. When we start looking at practices that add physical inputs.
Like vibration or breath.
Exactly. Let's start with those instruments. Singing bowls. Tibetan or Himalayan bowls.
Right.
They're unique because it's not just sound. They produce this strong, palpable vibration that you can feel traveling through your body. The evidence here is still, low to moderate certainty. It's hard to run huge trials. But the patterns in the reviews are really consistent.
And what are they?
Almost every trial reports the same thing.
Yeah.
An increase in those high-level HRV indices we talked about. Things like RMSSD and HF power.
Which, just to remind everyone, are the gold standard for measuring what exactly?
They're the clearest mathematical signals we have that the parasympathetic system, the rest and digest system, is fully engaged. And along with that, you see a consistent drop in resting heart rate. It's that signature we're looking for.
And the most important part is how it compares to just lying still.
Exactly. The evidence suggests a session with singing bowls leads to a deeper and faster physiological relaxation than just lying down in silence.
So it's not just a placebo effect.
It suggests the acoustic and the vibratory input is adding a unique active component. The vibration itself is doing something extra to modulate the nervous system.
Which makes me think about the other active input we have, our own voice. Singing, chanting, mantras. Yeah. We're now adding in controlled breath pacing.
And researchers are even calling it structured respiratory training.
I love that.
It's a fascinating area. It connects sound not just to the nervous system, but to the physical health of your blood vessels. There was a remarkable trial on older adults with coronary artery disease.
Okay, what did they have them do?
They had them sing along to a 30-minute video. Yeah. And it didn't just make them feel calm. It actually improved their microvascular endothelial function.
Whoa, wait. So that's the responsiveness of the tiny little blood vessels?
The tiny capillaries. Their ability to dilate and constrict effectively. It's crucial for getting oxygen and nutrients where they need to go.
So you're telling me singing a song physically improves how my small blood vessels perform. That's a mechanical effect.
It is a mechanical effect, and it's channeled mainly through the breath. There is even ongoing research showing that brief solo singing like 14 minutes can acutely improve vascular function.
You don't even need a choir.
No, the benefit is surprisingly rapid. Though the group aspect does add something.
Sure.
Group chanting, for instance, is inherently tied to synchronized, slower breathing. You just naturally fall into that shared rhythm. And that synchronization forces the breath to slow down, to deepen, and that is the exact signature linked to better stress resilience. The voice becomes a natural metronome for the body.
Okay, let's push this to the absolute limit. The ultimate stress test environment. An invasive procedure.
Right.
If sound can work there, when the body is under maximum duress, then its power is undeniable. We're talking about things like cardiac catheterization.
And we have fantastic data from a pilot study called MUSEI. It focused on patients having a percutaneous coronary intervention, or PCI.
That's the procedure to open up blocked arteries.
Exactly. So patients were randomized to get music before and during the procedure, and the results were, well, they were dramatic.
How dramatic.
Significantly lower post-procedural systolic blood pressure, plus reduced pain scores and a lower heart rate compared to the control group.
Give us the numbers. How much lower was the blood pressure?
The music group averaged a post-procedural systolic pressure of around 120, the control group 134.
A 14-point drop.
Yeah.
Immediately after a highly invasive, stressful procedure, solely from a sound intervention. That is an astounding difference. I mean, that's the difference between a high normal reading and a stage 1 hypertension reading.
It is. Clinically, preventing that post-procedure stress spike is crucial. That 14-point difference confirms sound isn't just a distraction. It is actively blocking the body's acute stress response in a high-stakes situation.
And this isn't a one-off finding.
No, not at all. The broader meta-analytic data confirms this pattern across all kinds of cardiac interventions. Periprocedural music consistently helps with anxiety, heart rate, blood pressure, respiratory rate.
Which really argues for personalized, context-aware sound dosing.
Yes.
It can't be a one-size-fits-all playlist. You have to match the content, the tempo, the tone to the phase of the procedure and what you're trying to achieve with the nervous system.
Precisely. Slow tempos for pre-op calm, something else for post-op stabilization.
So what does this all mean for you listening right now? We've covered a lot. Clinical trials, specific instruments, vascular impacts. Let's distill this into some actionable insights.
Right. We can translate all this into some design principles for your own cardiovascular health.
Okay.
The first one is about autonomic rebalancing. We keep coming back to those HRV increases and the small drops in heart rate. Those are the signals of stronger parasympathetic engagement.
The brakes.
The brakes. So if you choose a 15-minute sound practice, the goal is that slow, steady rhythm to achieve that rebalance.
So it's not about just picking any music I like if I'm stressed.
Not if the goal is rebalancing. Avoid anything that increases mental intensity. Focus on sounds designed to slow your internal clock. Second is stress reduction. Sound is a powerful tool for reducing your perception of anxiety and pain. And when you do that, you stop that cascade of stress hormones like cortisol. You make your internal environment less hostile to your heart.
Preventative.
It is. Third is that really intriguing new finding on vascular support. The singing research shows vocalization can acutely improve microvascular tone.
Right.
This suggests that active practices where you're using your voice or feeling a vibration might give you more direct physical benefits than just passive listening.
That's a key distinction.
Yeah.
Passive listening for mental calm versus active participation for a physical change.
Exactly. Which leads to the fourth principle, the power of entrainment. Slow, steady tempos support synchronized, slow breathing. And if you compare sound with guided exhalation, lengthening breathing out longer than you breathe in, you massively stabilize your cardiovascular dynamics and you spec your HRV.
This is why chanting and singing work so well. The sound forces your breath to obey.
It does. The structure does the work for you.
It's just so exciting to see how this is all moving out of the lab. The sources we looked at note that trials are expanding into really specialized populations, even things like sound delivery for newborns with congenital heart disease. The future of sound as medicine seems vast.
It really does.
So to recap everything for you, we've shown that sound is a direct physiological input. We've seen how music therapy provides real stabilization in clinical settings, how instruments like singing bowls can get you to deep relaxation faster through vibration, and how vocal practices, singing, chanting act as a form of structured respiratory training that can improve your vascular function. It all points to sound as a tool to modulate your autonomic nervous system, support your blood vessels, and lower your stress hormones.
Which leaves us with a final provocative thought for you to explore on your own.
Okay.
Given that we keep seeing entrainment synchronizing your internal rhythm to a slow external beat as this major pathway for benefit, how might you use that? How might intentionally blending simple vocalization like humming or a mantra you choose with slow breathing cues offer a powerful and essentially free tool for daily cardiovascular hygiene?
Right.
You don't need any musical training, just the willingness to use your own voice to influence and stabilize your own deepest physiology.
A profound and very actionable concept to take away. Thanks for diving deep with us today. We'll see you next time.